Did you know your fingernails might be silently warning you about serious, even deadly health problems? That's right. What looks like a simple change in nail color, shape, or texture could be a hidden sign of heart disease, liver damage, or even cancer. Most people ignore these tiny changes, but your body is constantly sending you messages. The question is, are you paying attention? And here's the good news. Everything shared in this video has been carefully reviewed and validated by licensed health professionals. So you're not just getting tips, you're getting trusted, accurate information to help you stay healthy and alert. So if you want to spot red flags before they turn into serious problems, keep watching. Let's dive into 10 things your nails can reveal about your health and what to do if you spot them. 1. Pale or white nails. If your nails have turned unusually pale or white, it could be more than just aging or a sign you're feeling tired. Pale nails are often linked to a low red blood cell count, known as anemia, which reduces the oxygen delivered to your body's tissues. But here's the surprising part. This same symptom can also indicate liver disease, congestive heart failure, or severe malnutrition, especially in older adults or people recovering from illness. And it doesn't stop there. Chronic kidney disease and hypothyroidism have also been linked to white or washed-out nails. In fact, some doctors refer to these as Terry's nails, when they appear mostly white with a narrow pink or brown band at the tip. Here's a quick test. Gently press the nail and release. If color takes longer than 2 seconds to return, it could be a circulation or oxygen issue. Visual clue. If the nail is white with darker rims, that's a red flag often seen in hepatitis or other liver conditions. So the next time you clip your nails, don't just clean them, observe them. Your body could be waving a silent flag asking for attention. And speaking of unusual colors, let's jump to the second sign. Yellow nails. Yellow nails are often blamed on nail polish stains or fungal infections. And while that's true, persistent yellowing can be a deeper health warning. This kind of discoloration can occur in people with chronic bronchitis, lung disease, or diabetes, especially if it's accompanied by slow nail growth or thickening. Here's where it gets even more interesting. Yellow nails could be a sign that your lymphatic system isn't draining properly, causing fluid to build up in the hands and feet. This is part of a rare condition called yellow nail syndrome, which often comes with respiratory problems, lymphedema, and brittle nails. Here is the fun fact. Smoking can also stain the nails yellow due to tar and nicotine, but if the yellow is under the surface, not just on top, it's likely internal, not external. In short, if your nails are turning yellow and no polish or fungus is to blame, listen to your body. And when nails turn not yellow but blue, that's a sign of something even more urgent. 3. Bluish nails. At first glance, bluish nails might seem harmless. Maybe your hands are just cold. But when that bluish tint sticks around, it's often a sign that your blood isn't carrying enough oxygen. This condition is called cyanosis, and it's commonly linked to lung conditions like COPD, asthma, or even pneumonia. In some cases, it may point to poor heart circulation or a condition known as Raynaud's disease, where blood vessels temporarily constrict. Here's the surprising part. Bluish nails can also show up after a heart attack or in people with congenital heart defects. It may even appear in high altitudes or due to certain medications that limit blood flow. You might also notice your lips or toes turning blue along with your nails. That's a major clue that your entire circulatory system is under stress. So remember, if your nails are blue and you haven't been outside in the cold, your body might be low on oxygen. That's a message you shouldn't ignore. And if instead of blue, you spot a dark stripe under your nail, the next warning is even more serious. And I'm talking here about dark lines under nails as our fourth sign. A single dark stripe under your nail may seem like a bruise or a harmless streak of pigment. But if it appears without trauma, or begins to darken, widen, or change shape, it could be a hidden warning sign of melanoma, the most dangerous type of skin cancer. This condition is known as subungual melanoma, and unlike other forms of skin cancer, it doesn't usually appear on exposed skin. It hides under the nail, often without pain or irritation, making it easy to miss critical insight. This type of melanoma is more common in people with darker skin tones, particularly under the thumb, big toe, or index fingernail. And sadly, it's often diagnosed too late, since most people assume it's just a mark or bruise. But nail texture can speak just as loudly. Let's take a closer look with this fifth sign, rippled or pitted nails. If your nails have tiny dents or pits on the surface, it could be an early sign of psoriasis, a chronic autoimmune condition. In fact, 1 in 2 people with nail psoriasis develop pitted nails before the skin symptoms even appear. This nail pattern is also linked to inflammatory diseases like eczema or alopecia areata, a condition that causes hair loss. That means your nails could be showing the first signs of an immune system imbalance. And speaking of signs that show up before bigger problems, 6 cracked or split nails. Dry, brittle nails are often blamed on overuse of polish or exposure to water. But when they crack or split persistently, it may be something deeper, like thyroid disease or iron deficiency. Surprising twist. When splitting occurs with a yellowish tint, it might point to a fungal infection on top of an existing deficiency, essentially a double warning. And while breaking nails can be frustrating, swollen areas around them can be painful and just as telling. 7. Puffy nail fold, redness around nails. If the skin around your nails is red, puffy, or swollen, especially at the cuticles, it could be a sign of infection. But in more serious cases, it can be associated with lupus or other connective tissue diseases. Did you know? Chronic inflammation of the nail fold is often one of the earliest signs of autoimmune flare-ups. It's like your immune system is showing its struggle right on your fingertips. And if you've ever noticed your nails lifting off the skin, this next sign might explain why. 8. Nail separation, also known as onycholysis. When the nail starts to lift from the nail bed, leaving a gap underneath, it's not just a cosmetic issue. This condition, called onycholysis, can be caused by injury or infection, but also by thyroid disorders, especially hyperthyroidism. If your nail is literally detaching, your body is trying to say something's off. And speaking of speed, what if your nails are growing unusually slow or fast? 9. Slow nail growth. Nails typically grow about 3 millimeters per month, but if yours are growing noticeably slower, it might reflect more than just aging. Conditions like poor blood circulation, chronic stress, or even kidney disease can slow down nail growth. Unexpected tip. Nail growth can also be affected by poor sleep quality. So if you've noticed your nails seem frozen in time, it might be time to look at your overall lifestyle, not just your hands. Finally, there's one sign that often signals a serious health event, right after it happens. Horizontal ridges, Bow's lines. These deep horizontal grooves are like a timestamp on your nails. They usually show up after a serious illness, surgery, or extreme stress that temporarily halts nail growth. Infections like COVID-19 have even been linked to Bow's lines appearing weeks later. Here's the amazing part. You can sometimes trace back the exact time of the stressful event based on how far the line is from your nail bed. Your nails become a living calendar of your body's past trauma. As you've just seen, your nails are much more than a grooming detail. They're a silent messenger for your internal health. Color, shape, texture, and speed all offer important clues that shouldn't be ignored. Now that you know what to look for, take a closer look at your own nails today. Spotting these signs early could lead to life-saving conversations with your doctor. If you found this helpful, consider sharing it with someone you care about. It might help them catch a warning sign before it's too late.